A pleasant day to all of you. I am Lyndell Kaye and I am going to be your student nurse for today. A sterile field is an area to keep free from microorganisms. It is an area to protect the health and safety of a patient during a medical procedure, usually a surgery. This environment is aseptic. All items in the surgery are all sterilized and shouldn't contain any microorganisms. Maintaining aseptic conditions is critical for surgical safety, as an infection could be very dangerous to the patient. Before obtaining the preparation of the sterile field, the circulator must wash his or her hands thoroughly to prevent the transfer of microorganisms. And don surgical cap. The surgical cap should cover the hair completely to prevent contamination of the sterile area. He or she then don a clean cotton scrub suit and mask before entering the semi-restricted area or surgical unit or suite. For the equipments, we will be using package containing a sterile drapes, specific sterile equipment needed, sterile sponge and gauze, antiseptic solution, betadine or alcohol, back table, basin set, and small wrapped items. Prepare the back table by covering it with a sterile or table cover. The back table allows a large surface to open all other supplies onto it during setup, and it is the main sterile field. Identify and confirm the type of operation or surgery before preparing the sterile field. This is to know the surgical instruments and equipment to be prepared. Good morning, ma'am. I am Lyndell Kaye, your nurse for today. I'll just confirm if you are Miss Pinolyard, who will have a minor surgery, which is appendectomy.
Yes.
Here. Okay, thank you for confirming, ma'am. Okay, for now, ma'am, you may now have your rest before you undergo your surgery. Thank you, ma'am. Confirm the sterility of the package. To ensure that the package is clean and dry, moist indicates contamination and package must be discarded. Select clean work surface above waist level. Below waist level is considered contaminated. Assemble all supplies and equipment needed to promote efficiency. Place the package at the center of work area so that the top flap of the wrapper opens away from you. This is to prevent subsequent reaching over the exposed sterile contents. This could contaminate the content of the package. Pinch the wrapper's top flap between thumb and index finger. Touching only the outside of the wrapper maintains the sterility of the wrapper's content. Repeat for side flops, opening the top one first. Use the right hand for the right flop and left hand for the left flop. By using both hands, it will avoid reaching over the sterile field. Pull the fourth flap or the innermost flap towards you, allowing it to fall flat on the surface. Make sure that the flap does not touch your uniform. If the inner surface touches any unsterile article like the uniform, it is considered contaminated. Open a sterile item while holding outside wrapper in non-dominant hand. To free dominant hand, unwrapping the outer package. Carefully peel wrapper onto dominant hand. Items remain sterile. Inner surface of the wrapper covers hands, making it sterile. Place items carefully within the sterile field. Small items such as gauze dressing may be dropped 6 to 8 inches above the sterile field. Large items should be put down carefully to prevent accidental contamination of the field. Dispose outer wrapper to prevent contamination of the sterile field. While waiting for the surgery to begin, cover the sterile instruments and equipment with other sterile OR table cover to prevent contamination of the items inside the OR table. Read the solution label and strength 3 times to ensure correctness of the solution to be given and to prevent error. 5% dextrose in lactated ringers, 5% dextrose in lactated ringers, 5% dextrose in lactated ringers. Remove the lid and place sterile side up onto a clean surface to prevent contamination of the lid. While holding the bottle, pour the liquid 6 to 8 inches above the sterile container in the sterile field to avoid the possibility of the two containers touching each other. Pour slowly and carefully to prevent splashing. If liquid is spilled in the sterile field, the spot is considered contaminated. Keep your arm and body as far as possible from the sterile field. Avoid reaching and touching over the sterile field to prevent contamination of the sterile area. For the equipments, we will be using package containing a sterile drapes, specific sterile equipment needed, sterile sponge and gauze, antiseptic solution, betadine or alcohol, back table, basin set, and small wrapped items.